Handling HIV positive and hepatitis B positive body. HIV infection should be suspect if the body is of a male homosexual, an intravenous drug abuser, a hemophiliac who has received a repeated blood transfusion, a female prostitute, a victim of sex abuse. The staff should be vaccinated against hepatitis B and revaccinated at intervals when the antibody titer falls below protective level. At every stage, care should be taken to avoid direct contact of skin and mucous membrane with the body fluid and tissue. Hands should be washed thoroughly with soap and water after each activity, even if gloves are worn. Special precautions are necessary at each stage at the scene, in the autopsy room, in the laboratory, and in the court. In addition to general precaution at the scene, disposable shoe protection by person at the scene is necessary. Food or smoking should not be allowed at the scene. Blood contaminated clothing or other material should be handled carefully. Dried blood or wet blood material that is not stored as evidence should be decontaminated and properly disposed of by incineration. Non-disposable material used during the investigation and collection of evidence at the scene should be decontaminated by usual hypochlorite solution. In the autopsy room, admission non-authorized person should be admitted to the autopsy and body preparation rooms. Clothing protection includes complete covering of the body by wearing double gloves, gowns, waterproof apron, caps, mask, goggles. If eyeglasses are not worn, shoe covers. Instruments, minimum instruments as required to should be kept at the start of the autopsy. A knife, a scalpel, a scissor, forceps are kept to start with. A scissor with a slightly blunted object should be routinely used, and the small sharp ones only when needed. Special care is necessary to handle sharp items such as needles and scalpel to prevent accidental pricks and cuts. Disposable requirement, instruments, working surface used in the procedure, associated gloves, protective clothing, and waste material should be disinfected, sterilized, or incinerated as appropriate. Handling specimen for laboratory examination. Gloves should be worn at all times by laboratory as well as our autopsy room and mortuary personnel when handling specimen from suspected cases. Cleanup procedure. New intact disposable gloves should be worn. Small patches and spill of blood and other body fluid can be wiped up with disposable tissues or towels which are discarded in a special biohazard bag and properly disposed of, and the area then covered with a disinfectant and wiped clean. Disinfection. A 1:10 dilution of household bleach or a freshly prepared sodium hypochlorite solution. The active ingredient in the bleach in equivalent concentration of 5000 ppm is recommended. Accident, injury, and prophylaxis. In the event of an accident, injury, contaminated or not with a bloody or a body fluid, either an autopsy and laboratory, the wound should be disinfected and the incident report to the proper authority. Blood should be taken from the source of exposure and tested for HIV and hepatitis B. Blood sample should be taken from the injured person for immediate testing and for comparing during the follow period. The test should be repeated at 6 weeks, 3 months, 6 months, and 1 year after the episode. Any person who is accidentally exposed to HIV should have a prophylactic course of pseudobody 100 mg twice a day for 6 weeks. Any person exposed to hepatitis B and who is not vaccinated should have prophylactic hepatitis B immunoglobulin within 72 hours of the incident, followed by active vaccination. The laboratory disposable gloves would be worn. Countertop covers used in areas where biological material is examined. This should be disposed of in a authorized manner. Food or smoking should not be allowed in the work area. All the biological specimens should be considered contaminated and treated accordingly. Mouth pipetting and biological material should not be allowed. If possible, specimen to be destroyed should be burned or chemically decontaminated. Hands would be washed before leaving the work area. In the court, whenever possible, biologically contaminated evidence should be referred by photographic or other means rather than presenting it in court. When necessary, bullets, clothing, etc. should be handled using disposable gloves and over paper or the dry, not wet, moist evidence should be enclosed in a sealed, clear plastic bag. The hands should be washed after handling the evidences. General precaution. Best key to control the dissemination of HIV or hepatitis B is prevention. Prevention of unnecessary contamination in the work area of injury. Prevention requires strict attention to details, carrying out the record autopsy and body preparation procedure with care and neatly and cleanly, avoiding splattering and confining any flow of body fluid within limited bounds of the work area. The main danger to all personnel would be any action that produces aerosol of biological material such as produced by saw during autopsy or by a blender in toxicological studies. The most common known method of accident exposure include being pricked up with a used needle or with a contaminated material, and the contamination of an area or surface which could not be expected to be so by the thoughtless technique of careless fellow employee, washing hands and cleaning floors, doors, doorknobs, and telephone with a disinfectant capable of killing viruses which will protect the employees. Thank